not genetic. Okay, why? If genetic, your body tends to produce a lot of cholesterol, so you'll produce a lot of HDL and LDL. Because the good cholesterol HDL and LDL bad cholesterol are both produced by the body. So if more to genetic, you tend to produce both the good cholesterol and the bad cholesterol very high. In LDL here is 4.4, and the reading we need to be normal cannot exceed 2.58. So we use the same way of calculations. It's 4.4, the current reading, minus 2.58, the standard, divide by 2.58 times 100%. Then you will see how much percentage of LDL surplus we produce. So it's 4.4 minus with 2.58 divided by 2.58 times 100%. So what is the answer? We're going to get something around 70%, you're not mistaken. We can calculate 4.4 minus 2.58. You get 1.82 divided by 2.58 times 100%. You get 70.5%. So it's 70% surplus. So you can see that its LDL production is more than 70% from the normal. Hi, welcome to another session of Decode Blood Test Report with me, Charles, your nutritionist. Let's start with today's report with the ASMT, age, sex, medication, and treatment. So we have a report here, 67 years old male, and without any history of taking any medications, and then no particular treatment he's been through. So we start with the report. The first part we look at the report is on the full blood count. It's looking at the blood itself. We are looking at three main components of the blood: the red blood cells that carry oxygen, the white blood cells is actually our immune system, and lastly will be on the platelet count that helps in blood clotting. So from the report, you can see that the red cell count is the red blood cells is 5.6, actually is within the normal range. 4.5 to 6.5 is considered sufficient. That means this individual, this guy, has sufficient red blood cells in the body that carry oxygen throughout the whole body. Then we look at the hemoglobin. Hemoglobin is 16.7, also within range. Hemoglobin is the component in the red blood cells. Okay, it's made from iron that really binds with oxygen. So basically, if someone is low in hemoglobin, it means that they're having anemia, a very specific anemia, iron deficient anemia. Because hemoglobin is basically made from iron. So when you lack of iron in your meals, you will have this problem with low hemoglobin. So enough of red blood cell and enough of the component of hemoglobin in the blood too. So basically, this guy is not having any anemic issue. Then we look at the hematocrit PCV. Is basically you look at the reading is a percentage. It means the entire blood itself, like I said, comprises of a lot of things. Mainly in terms of cells, we have the red blood cell, white blood cells, and the platelet. So in terms of the red blood cell, in overall, the percentage is it normal? So you can see that the percentage is 52%, whereby it's sufficient, is normal, because from 40 to 54% is normal. So basically, this individual has enough blood in terms of percentage, also sufficient. No issue there. Then we look at the MCV, MCH, MCHC. Basically, in terms of easier way to understand it, is more on the shape, size, and color of the red blood cells. So sometimes the red blood cells can be distorted in shape, lack in color, look anemic like pinkish instead of red. All these things will be revealed in the three readings of MCV, MCH, and MCHC. Basically, the shape, size, and color of the red cell to make it simple. So for this individual, all the three readings are within normal range, so nothing wrong with that. Then we look at the second one we mentioned earlier on is different type of cells found in the blood is platelet. Platelet is basically for blood clotting. So when you have a cut, platelet in the blood will go to the area of the wounded area to clot that to prevent further bleeding. So not too high, not too low. Because too much of platelet will cause blood clot in the bloodstream and it goes to the brain, it can block and cause stroke. So we do not need too high platelet and also cannot be too low. Too low, you have this easy internal bleeding or bleeding excessively, especially in cases with dengue fever, whereby the platelet count will drop so low it can be fatal. That's why we need it to be the range of 150 to 450, as you can see here. And for this guy individual, at the age of 67, still having 230, whereby it's in the middle, the best reading of all. So no issue with platelet. We go further down to the red cell distribution with RDW. Basically, this reading is very unique to the red blood cells we mentioned earlier on. Just now we mentioned the blood that carry oxygen is red blood cells. So beside the shape, color, and everything about the red blood cells, is another thing we measure here is the distance between the red blood cell. We call the red cell distribution width, the distance between red blood cells. So this is also very important because healthy blood, they tend to have iron, we call it energy, around the cells, so the cell will not clump together. But when the cell is dying, it will go clumping together, so it will actually show the distance. So basically, different type of anemic situation like megalobus anemia, we have very big red blood cell, sickle cell anemia, or you can see that the distance will be affected, especially in cases of genetic thalassemia, whereby you can see the red blood cell is smaller and then the distance will be wider. This is how we interpret different type of anemic situation among individuals. But for this guy, the RDW, the red cell distribution rate is also normal. So basically, he's have sufficient blood, not anemic. Platelet count is sufficient. It's not too high, not too low for blood clotting. Then we look at the third cells that we mentioned is the white blood cells, whereby you can see here is the white cell count, WCC. WCC means that the white blood cell in total. And for the white blood cell in the body, there are actually 5 major types. Different type, different function, different immune response. So for overall, he's having 7.6, whereby it's normal. Normal rate is 4 till 11. Of course, immune system stronger is better. Okay, so if the reading is above 7, so 4 till 11 is normal range, middle will be around 7. So you are 7 above, you are considered a bit strong. Immune system considered on the strong side, but not to exceed 11, because when exceed 11 can be another issue too. The most serious will be like blood cancer, whereby you have these lymphoma issues or all this blood cancer, non-Hodgkin's lymphoma, whereby too much of white blood cell, that's normal. So not too much over 11, but above 7 will be something commendable that we want, because we want to have more white blood cells to show that we are stronger in terms of our immune system. So what are the different types of white blood cells that we mentioned? There are 5 types. Basically, the first one, we have the neutrophils. Then we have the lymphocyte, monocyte, eosinophil, and basophils. All of these different types of white blood cells have different functions. Some attack virus, some attack bacteria, some attack fungi, some allergic reactions, some inflammation. All these 5 types have different function in a way. So basically, when someone is normal, you don't see any issue there. But for this individual, you can see that the neutrophil is normal, 70. Lymphocytes is a bit low, 16. Monocyte is a bit high, 13. And then eosinophil, basophil should be very low, because this two is basically mostly due to allergic reactions, but mostly is very low. You can see that eosinophil is 1 to 6, and then basophil is 0 to 1. So this two is the least type of white blood cell in the body. But you can see that in this condition, he's having lymphocyte 16, whereby it's low, and monocyte 13 is a bit high. So is it a very serious condition? Basically, no. Because you can see that the total white cell count, 7.6, basically is normal. And our body are exposed to a lot of germs, bacteria, virus throughout the whole day. And our body immune system will react to it. So we can say that during that day, when this guy go for this blood test, there are some immune reaction in the body. And what we see here is the lymphocyte is low. Lymphocyte basically cater for viral, virus infection. So low, it means that there are 2 reasons. One, the body are weak towards viral infection, or 2, maybe a recent viral infection. Maybe it's just a flu, a simple flu. Okay, but why is it low? Because after you kill all this virus, the white blood cells will die together too. Okay, so when all these virus and die together, the white blood cells, then our body monocytes, we can see that it's 30 is a bit high, will do the job. Monocyte is basically doing this phagocytosis, eating, or we call it cleaning our body of all the dead cells and all this dead virus, dead bacteria. It's more like cleaning after that. After viral infection or bacterial infections, our immune system will kill all this virus and bacteria. Once all this dead resolved already, then we need someone to clear off all these remaining residues in the body, all the dead cells of the virus and bacteria, and even our white blood cells that confronted the bacteria and virus, and in the process kill the germs. At the same time, the white blood cell will be dead too, so we need to remove it. So basically, from what we see here is a very simple immune reaction in the body and nothing alarming about it. So basically, this individual having good blood, enough white blood cell, sufficient platelet for blood clotting, not too much, and then immune system is on the high side. And today, from the report, we can see that maybe he just have a recent viral infection, a very simple flu, and he already killed Okay, then we look at the blood group. Blood group is B positive, so he can take back B positive blood and O positive blood, these two category of blood. Okay, it's compatible to his body. Then we look into the lipid profile. We're looking at the cholesterol level. Total cholesterol 6.2 is high, above 5.2. Then HDL, the good cholesterol is 1.4, whereby it's sufficient. The LDL bad cholesterol is 4.4, is a bit high. And then we have the triglycerides, the oil that basically coming from the food that we consume. Then that is low, 0.8, whereby it's good too. And then the total over HDL cholesterol ratio is 4.4, is below 4.6. That means it's normal. So basically from this blood report, lipid profile, so what is the cause behind the high cholesterol LDL here? A lot of people would think that, do I eat too much of oil? Do I need to restrict my diet? Is it inheritance whatsoever? From this report, we can see that basically the main reason behind this, we can see that the probability highest is definitely not genetic. Okay, why? If genetic, your body tends to produce a lot of cholesterol, so you'll produce a lot of HDL and LDL. Because the good cholesterol HDL and LDL bad cholesterol are both produced by the body. So if more to genetic, you tend to produce both the good cholesterol and the bad cholesterol very high in a way. So basically from what we see here, is not really the case. LDL here is 4.4, and the reading we need to be normal cannot exceed 2.58. So we use the same way of calculations. It's 4.4, the current reading, minus 2.58, the standard, divide by 2.58 times 100%. Then you will see how much percentage of LDL surplus we produce. So it's 4.4 minus with 2.58 divide by 2.58 times 100%. So what is the answer? We're going to get something around 70%, you're not mistaken. We can calculate 4.4 minus 2.58, you get 1.82, divide by 2.58 times 100%, you get 70.5%. So it's 70% surplus. So you can see that its LDL production is more than 70% from the normal. So you can see that the difference between HDL cholesterol and LDL, the bad cholesterol, yes, both are producing more, but if both is due to genetic, you can see that the ratio is more or less the same. It's not like 150, 170, maybe both around 50, 60, will not see the increase of HDL 20% more compared to HDL. So in this case, obviously the reading is only HDL is very, LDL is very high, whereby it's 4.4, is above 70% from the normal. So this is not genetic, basically. We can see that it's not really genetic. There are chances, but the probability is not that high. Is it diet? Also not diet. Diet basically will increase the cholesterol in the blood in terms of triglycerides, and we see from the report the triglycerides actually on the low side, 0.88. It shows that diet wise is not an issue to this individual because the bloodstream contains only very less triglyceride, 0.88. It's not even higher than the normal. Normal can go to 1.7, and he is only having 0.8. That means half of the normal standard. So not even exceed, but half of the normal standard. So overall, triglyceride is not the issue, diet is not the issue. So it's not diet, it's not genetic. Anything else? It can be due to liver metabolism. The liver is not doing well because liver produce all the cholesterol in the bloodstream, the HDL and the LDL. But when you look at it itself, is not an issue because HDL is also normal in this rate. That means your liver is still trying its best to compensate for the elevated LDL. So overall, liver metabolism is not that big issue here. And then the last main factor or the most probable culprit behind the high elevated LDL will be this oxidation of LDL. That means too much of free radical in the body oxidize the LDL. So when oxidized LDL, it will lose its function. So the liver have to produce more or to complement or to stabilize the situation itself. And why is it happening? And why these free radicals is oxidating our LDL, causing the increase of production? I can explain in details, but it will take much longer time. So I recommend you to click on the link below on the video that I have done before, sharing about different type of LDL, HDL, different type of cholesterol, and why free radicals cause increase in LDL productions. Okay, you might find the answer there. I will explain in very details in that particular video. So here, from what we see, this individual, 67 years old, having cholesterol issue is not the diet, not so much of genetic, and is also not due to liver issue. It's basically free radicals. So this is the thing that we need to resolve later on. Do you want me to help you decode your blood test report? Or you need a one-to-one live consultation session? Then click on the link in the description below for further information. Okay, then we turn to the next page. Next page, we're going to look at the liver functions. As we can see that just now we mentioned, liver also play a major role in our cholesterol control. So we look at the liver here. We start out with the liver protein, total protein, 75, whereby it's normal. Then protoprotein is the combination of the albumin and globulin, two types of protein found in the liver. So you can see albumin is 47, globulin is 28. So when you add up these two, 47 plus 28, you have 75. That's the total protein. So albumin is basically more on the overall cells productions. You have wound healing, cells regeneration. You require a lot of this albumin. And globulin is more on immune system. All our antibody in the body, we call it immunoglobulin, is actually made from this particular protein. So we see some immune reactions very strong. You can see that the ratio, the AG ratio will change. But overall for this guy, 67 years old, all the protein, albumin, globulin, and the ratio is all perfectly normal. That means body have sufficient protein and also can be stated as enough sufficient nutrients too. Because our body, when it depletes of nutrients, our body will burn carbohydrate, sugar as the main energy, then will burn fat as the second. Then when both of these sugar and fat are gone, only our body will use protein to generate energy. So basically, protein is the last resort of energy in the body, and it's very important to be sufficient. And all this protein basically not kept in the muscle, is actually kept in the liver, the largest organ in the body. So having sufficient protein in the blood test report also indicate that your body has sufficient nutrients in terms of energy. Okay, then we look at the total bilirubin. 14, whereby it's good, we need to be below 20. When you are seeing readings above 20, it can due to all this digestive issue, because bilirubin is very much related with the gallbladder juice, okay, that helps in fat digestions or lipid digestions itself. So when you have seen elevated bilirubin, you might have jaundice, yellowish of the skin, or gallbladder stones issue, or even hepatitis, inflammation of the liver. But for his case, it's normal. Then we have the enzymes for the liver. We have the alkaline phosphatase, SGOT, SGPT, and GGT. These are the enzymes very unique to the liver. So if you see elevation of enzyme, it means that the cells in the liver are prone. A lot of cells died, because when the cell in the liver died and then it erupts, and then the enzyme found in the cell will be going into the bloodstream. So when you see elevation in the bloodstream of this enzyme, it means that the liver has been damaged. Okay, a lot of liver cells died. So it can be due to hepatitis, inflammation of the liver, cirrhosis, hardening of the liver, or liver cancer. Can a lot of complications that happens to the liver that can cause the elevation of this enzyme found in the liver. Even alcohol, drinking too much, medication, taking too much of toxins, chemicals in the body also will elevate these readings found in the liver. But for him, all are okay. We can say that the current condition of the livers are okay, and then the function also is okay at the moment from what we see. Then we go on to the renal function. We start with glucose. Glucose is for the sugar content found in the bloodstream. So for me, he told me that he's actually having this fasting of blood sugar. That means he fasted for 8 to 10 hours before he go for the blood test. So from the report here, it's slightly a bit elevated, 5.8, but no big issue, especially for someone who already 67 years old. His metabolic rate might not be so strong. So the utilization rate of sugar might not be that fast in comparison to the young adults or teenagers. So for him, 5.8 to me is acceptable. Anything not exceeding 8, 9, 10 shouldn't be an issue, because our body having sufficient time to kind of balance it back later on. No big deal. So 5.8 to me is not an issue, and for this particular individual too. Then we look at the kidney, the function of the kidney. Kidney is more like a filter of the blood that filter all these toxins or residues or things that we do not need from the bloodstream, all these toxins from the blood, including we have the urea, then we have the creatinine, then we have the uric acid too. These are the three components usually when we utilize protein in the body. Once you use a lot of protein, we eat a lot of protein, our body metabolize it, use it up. Then the residue, the leftover or the byproduct that we produce will be these three: urea, creatinine, and uric acid. Any of these three that goes up also will cause toxicity to the blood and also will brings a lot of complications too. For example, urea can cause uremia condition whereby you actually too much of toxins, and this urea basically the smell is very similar to the urine that we have. You smell a little bit acidic, like a little bit of ammonia smell to it. Yes, this is urea, and then we produce urea from protein metabolism, and we excrete it to our urine. So if your kidneys are functioning well, you will be able to excrete all this excessive urea, creatinine, and uric acid. But when you check the blood, you're having excessive, it means the kidney function is not doing that well. Your kidney should be able to excrete all these toxins out. So the reading should be within normal range. So from the report, we can see that the urea is the 3.1, the creatinine is 102, uric acid is 0.44. Among the three, two are perfectly normal. Only the uric acid is slightly a bit high, 0.42. But to me, for this report, for him at 67 years old, is acceptable. For an elderly 67 years old guy, a bit low, higher in terms of toxin level, just a little bit high should be no issue. Maybe the metabolism rate, the body is not that efficient in clearing it. So it takes a bit longer time only. And how do I know that? We look at the particular reading written here. It's written EGFR. Means that it's estimation. Small e means estimation. It's been calculated. It's not properly measured from the bloodstream. Is being calculated. What is GFR? It's glomerular filtration rate. How efficient or how fast your kidney filter out toxins. This is the rate. So you can see that the reading is ml per minute. So how many ml is being produced within the minute? So how efficient is the kidney in secreting or excreting all these toxins? So the reading is 63, whereby it's okay. As you can see, anything that above 60 is considered normal kidney function or without kidney damage. So 63 is not really the best. Usually we recommend above 90. So some reports you can see that they actually recommend above 90 to be the best reading of all. But above 60 shouldn't be an issue. So especially for a 67 years old guy, so 63 is acceptable. So kidney function overall okay. And besides excreting toxins, the urea, creatinine, and uric acid, our kidney also have to preserve some minerals, some nutrients that we want, not to filter out too much of these minerals. Among all the minerals, actually we check only two here. One is calcium, the other is phosphate. Both also very important for our bone health and our teeth health. Okay, so you can see that 2.53 for calcium, 1.0 for calcium, both are within normal range. It means that the kidney is still functioning very well. Things that need to be excreted out has been excreted, need to be preserved in the blood, like minerals, is being preserved well in there too. Then we go to the last part of the second page, is the chemistry on hormones. And this report only tests one particular hormone, is the thyroid stimulating hormone. Okay, the hormone coming from the pituitary gland that stimulate the thyroid. Thyroid gland hormones we call the T3 and T4 is the metabolic hormones. Okay, how fast your body metabolism is controlled by the thyroid glands here. And today, our guy here is checking not the thyroid hormones, it's the thyroid stimulating hormone from the brain that control the thyroid. This hormone from the brain seems to be a bit on the low side, 0.48. Okay, is it a big issue? No big issue, but it just shows that this guy having a little bit lower metabolism rate that we expected, like we mentioned earlier on. Okay, the body seems to be aging in a way, and the metabolism rate seems to be slower. That's why the elevation of glucose and the elevation of uric acid in the body we see earlier on. Okay, is more to the lower because the brain production of hormones seems to be on the lower side. As you can see, the normal range is 0.35 to 5.5. So you can see that the median of the two is around 2 to 3. The reading to be considered good. Okay, above 3 will be better. That means you are high in hormone. That means your body are fast, reactive, and then at the same time young, vibrant. But on the low side, below 3 or below 2 is a little weak. It means the metabolic rate is slow. But for him, it's only 0.48 is on the lower side of the entire range. So you can see that we are expecting his body to be a bit slow, but we can do something about it to improve the metabolic rate. It's not a disease that he's having, it's just that overall metabolic rate is on the low side. This is what we see from the second page. Then we go to the third page. Third page, we're going to see on immunology. He went for 3 particular readings. One is VDRL. This is basically for all these sexually transmitted diseases like syphilis, gonorrhea, all this STD. We call it sexually transmitted diseases, whereby it's not reactive, whereby it's good. Then he went for the hepatitis B, antigen and antibody. So you can see that the HBS, the S means surface. Okay, antigen is negative. It means that the body do not detect any hepatitis B virus in the body, whereby it's a good sign. Okay, then at the same time, it also checked the HBs antibody. Do we have antibody against this hepatitis B? For him, it's also not detected. It means that he's not infected with hepatitis B virus. At the same time, the body do not have antibody to repel in case in the future got hepatitis infections. So usually in individual like this, we will recommend them to go for hepatitis B vaccinations. And it also depends on the needs. If we do not feel the needs because this is infections, you need to someone to infect you. If you're taking good care of a lifestyle and then reducing the risk, high risk activities, or sharing needle and then tattooing, or without safe sex, or these things, then might not be 100% compulsory. If you want to be safe, you can always go for vaccination, the triple dose of the hepatitis B vaccinations. Then we go for the tumor marker. He got only one particular tumor marker here. Is a CA, carcinoembryonic antigen. And this particular tumor marker is mostly and most time being related to the colon cancer. Okay, most only on the colon. And you can see that the reading need to be below 5. So 0.9 is considered very good. And then you might notice that some reports shows that if you're a smoker, the reading can go even higher. Okay, why? Because the tendency of smoker to have high CA is higher. What do you mean by CA? Carcinoembryonic, that means the early stage of cancer cell formation or abnormal tumor cell formations. So for those who have smokers have a lot of free radicals chemicals in the body, the chances is even higher that way. And those who have constipation, you might notice your reading for CA can be on the high side too, because when we can't pass bowel that well, and we tend to accumulate more of these stools in the body, and it can be bad for our colon and will cause cells mutation, and then the risk of colon cancer also can be increased too. So you might notice individual with constipations, difficulty or bowel issues, you will tend to have a bit higher CA readings. But for him, 0.9 is perfectly normal. Then we look at the urine analysis. In this report also, they check not only the blood, they also check the urine. Urine, first thing we look at is the physical part of the urine. When you look with our bare eyes, what we see in the urine. So we look at the color, is pale yellow, completely normal. Then pH, any pH between 5 to 8 is not considered normal. 7.5 is okay, slightly alkaline, nothing wrong with that. Specific gravity is to check is there any solutes or any stones or any solids found in the blood, in the urine. So for 1.015 is perfectly normal. Okay, then the bad thing that shouldn't be in the blood, when our kidney filter the blood, all the toxins will be out. The nutrients will be restored in the bloodstream. But if a kidney is not doing well, we will see things in the urine. Okay, we can see a lot of nutrients that shouldn't be there in the urine. For example, I can see the protein, glucose, ketone, blood, bilirubin. All these things shouldn't be in the urine. Okay, it should be filtered up effectively by the kidney. So negative is a good sign. So there's no protein, no glucose, no ketone, no blood, no bilirubin, no urobilinogen, no nitrite, and no leukocyte. So everything is negative is a bad sign. So the urine is basically clean. Then at the same time, we also will do this microscopy, whereby we use a drop of blood, a blob of urine, and enlarge it under microscope to see anything we can found in the urine or not. So from the microscope examination, we can see that there's no white blood cells, less than 1. And then WBC means white blood cells, the immune cells. RBC is the red blood cells, the red color, the blood. Is there any blood in the urine? Also no, less than 1. Then epithelial cell is all the dead skin, dead cells, also not seen. Cast crystal is all the stones that formed in the urine. That some people have kidney stone, urine stones. Basically, you can see from these cast and crystals. Then bacteria, no. Mucus, no. Others also no. So basically, the urine is perfectly clean. So from this report, you can see that overall, for a 67-year-old guy without any medication, without any particular treatment, or like all these nutritional treatments, or all these sensei treatment, traditional treatment, no treatments at all, the report is considered quite good. So now is the time for 2 on 2. So I'm going to highlight 2 issues that this individual can look into to improve. Okay, it can be a conditions, health condition is he's already having, or certain things that he can change or improve in a way. And I will give you some suggestion. So it's 2 on 2. So the first thing is having this high cholesterol issue. Like we mentioned earlier on, the chances and then the probability on the reason behind it can uh, summarize as free radicals in the body too much. It's not really about genetic, it's not really about diet anyway, or liver metabolism. Basically, it's more on free radicals. So in counter free radicals, we need to have a lot of antioxidants. It's more on the lifestyle changes. So if he's a smoker, okay, I will ask him to reduce smoking or quit smoking altogether, prevent a lot of radiation from the body, too much of electric gadgets around him, because all these radiating gadgets can produce a little bit of radiation, also will increase the radioactive, the free radicals found in the body too. So first is reducing exposure to free radicals. Second is to increase the body antioxidants, okay, through diets, because a lot of food that we consume can give us a lot of antioxidants. And antioxidants, there are 3 types. Basically, they have the vitamins type, the nutrients type, we call the vitamin A, C, E, selenium. Then we have the phytotypes from plants, all these colorful fruits and vegetables high in a lot of antioxidants like resveratrol, like the polyphenol, bioflavonoids, all the different color. The more vibrant the color, the better. More color, even the chlorophyll, green color found in all these vegetables is also antioxidants. So take more in terms of antioxidants from different sources of plants and vegetables and fruits, okay? And then we even have the enzymatic antioxidant like catalase, glutathione, SOD, spore oxide dismutase. All these things he can continue or recommended for him to take to counter this LDL issue. And he can actually go for another blood test in a year or after 4 months minimum, after he's doing what I'm recommended, okay, on increasing free radicals. Then if the issue is really due to free radicals oxidation or LDL, he will see an improvement there in terms of the reading, because you can see all the other readings in the cholesterol is all okay except LDL, that also increased total cholesterol. So once LDL back to normal, the total cholesterol from 6.6 should be back to below 6.2, should be back to below 5.2. Okay, so the issue here is only LDL, and the most probable reason behind it is due to oxidations, free radicals, so we need to have more antioxidants. And then the second thing that I recommend him is to tackle is on his metabolism, because we can see that the high sugar level is not too high, 5.8 is not too high, and then the high uric acid 0.44 also is not too high. It's just due to body is a bit aging, slow in terms of metabolism, and double confirmed through the hormones we check from this report is the thyroid stimulating hormone 0.48 is on the lower side of the normal readings. Okay, even though it's still within normal range, but it's on the lower side. It means that body do not produce a lot of hormones. So without this hormone, the body metabolism rate is going to be slower than normal. So especially when together we age some more, so a lot of things seem to be slower. The body metabolizing also tend to be slower. So for this, I recommend him to increase physical activity, because exercise will actually increase blood circulation, activate the cells, activate the brains, and then do more exercise or activities related with the brain. You can play Sudoku, you can do origami, and then that stimulate the brain. Because when the brain is stimulated, the production of thyroid stimulating hormone also will increase, and that indirectly will or directly will cause the thyroid hormone T3 to be increased. The entire metabolism of the body will increase, and we can see quite some changes here in terms of the glucose metabolism, uric acid metabolism. Everything should be improving. So that is quite important to know what is the reason behind the body having issues and what are things that we can improve. Meanwhile, if you're interested for another Decode blood test report video, click on the next video